Hi guys and welcome to Asthma. Today we're going to learn how to help someone who's having an asthma attack. So let's start. Okay, so first off, let's talk about what is asthma. Asthma is a medical condition that causes a narrowing in the airway inside of the lungs. Now, this medical condition, the asthma attack, usually happens after some sort of trigger. So for example, our patient can have an allergy reaction. He can have a cold that causes it, or being exposed to smoke and having a hard time to breathe. However, it is worthy to mention that in some cases, a patient can have an asthma attack without any noticeable trigger or something obvious that triggered it. Now, for the most part, asthma patients are usually very well informed about their situation, and they always carry an inhaler with them. So asthma patients can usually deal with mild asthma attacks by themselves, and they don't really need any help with that. However, when it comes to a severe asthma attack, then in some situations they might need our help as first aid providers. So this is what we're going to discuss today: how to help asthma patients with severe asthma attacks. Okay, cool. So how do we recognize that our patient is having a severe asthma attack and that he probably needs our help? The first way to recognize a severe asthma attack is by breathlessness or a hard time to breathe. This one is pretty obvious because of the narrowing in the airways in the lungs. He might have a really hard time to breathe, to speak, to walk even. So that is our first indicator. Another one is wheezing, and I hope I said that word right. It basically means when someone is breathing, we will hear a whistling sound when he breathes out and when he inhales. So that is also an indicator. Another one is a tight chest. In some asthma attacks, it will feel like he has a rubber band around his chest that is pressing on his chest, and it will feel tight. Asthma patients usually cough during asthma attacks. So if we see a lot of coughing, that is also an indicator. And lastly, he will have a bit bluish fingertips as well as a bit bluish lips. And that is because he won't have a lot of oxygen in his lungs. Okay, now the best way to treat an asthma attack is with an inhaler. However, in real life, we know that in some situations, our patient will not have an inhaler. And so in this video, we're going to cover actually two different treatments. One is if we have an inhaler, and the other one is if we don't. So let's start with what to do if we have an inhaler. Okay, so the first thing we want to do to help our asthma patient if we have an inhaler is we want to reassure him that we can help, calm him down, and then assist him using the inhaler. Now, the way we use an inhaler is, first off, we take the cap off, then we shake it, and we want to make sure we tell him to take out all of his breath to empty his lungs. Then we press down on the inhaler, we give him a puff, and we tell him to take a really, really slow breath. It should take about 5 to 7 seconds for him to take this breath. And he might even want to hold his breath after inhaling for another 5 to 7 seconds. That is how we do it. Now, if we have a spacer, that would be amazing, especially if it's for children. A spacer really helps making the inhaler medicine absorb more effectively in the lungs. So we do exactly the same. We just make sure we connect the spacer after we took the cap off, and then we shake it. Okay, now after we gave him a first dose, next thing we want to do is to make sure we take him away from the trigger if that is possible. Again, not in all situations that is possible, or not in all situations the trigger is obvious. Next, we want to make sure we sit him upright. If a person sits upright, then it would be easier for him to breathe than if he would lay down on the floor or if he would bend in some kind of way. So sitting him upright would be the next step. And then we want to give him a set of 4 inhales, 4 puffs. Now, we do it again as we did before. While he's sitting upright, we want to give him, we want him to empty his lungs. We want to make sure we press down and he inhale it slowly. And then we want to wait 1 minute between each puff. So when I say we want to give him a set of 4 puffs, I don't mean give him immediately 4 puffs. You want to wait about a minute between each puff and each puff, which, when I say it so many times, a puff sounds like such a funny word. Okay, so awesome. After you do that, you want to wait a few minutes, usually like 3, 4, 5 minutes, and you want to see if the situation is getting better. And if it got better, then perfect. You don't really need to call for help. You dealt with the situation correctly and everything is fine. However, in some severe situations, that might not help. So if you gave him 4 puffs and still no improvement, or the situation got worse, or if you found out that it's our patient's first asthma attack, or he started to become a bit more sleepy or drowsy, in that case, you want to call an ambulance immediately. Now, while waiting for the ambulance, you should give him another 4 puffs. So you do it exactly the same. You waited 5 minutes, you found out that it didn't help. You give him another set of 4 puffs, and you wait a minute between each puff. And after doing that, what you want to do is about every 20 minutes or so, you want to give another set of 4 puffs, basically until the ambulance arrives. So if it takes a really long while for the ambulance or for help to arrive, just give him 4 puffs every, sorry, why do I do 4? Every 20 minutes. And that's it. That's how we treat a patient if he has an inhaler. Okay, now what do we do if he doesn't have an inhaler? Obviously, in real life situations, we might come into a situation where a patient doesn't have one. So in the case that happens, first thing we want to do is to call for help immediately. Okay, we call an ambulance as soon as we see our patient is having an asthma attack. After we do that, the next step would be to take him away from the trigger, again, if it is possible. And next, we want to make sure that we sit him upright. If the patient is sitting upright, he can breathe more easily. We should even, if we see that he is wearing very tight clothes, we can loosen them up and make sure that he can breathe more easily. Personally, and I never seen anyone recommend this, but I found out from working out that if you put your hands behind your head, it will be even easier to take a breath inside. So I really recommend doing that as well. Okay, next, what you want to do is you want to make sure you calm your patient and that you tell him to focus on his breath. Okay, by this point, the ambulance should be on his way to you. So you want to make sure that he gets air into his lungs in the meantime. So just tell him to focus on his breath and take deep, slow breaths. Okay, obviously this would be extremely hard for a patient who is having an asthma attack and he is coughing and he can't really get breath. But if he can focus on taking deep breaths, then he will feel better until the ambulance arrives. Okay, and that is how we treat an asthma attack if we have and if we don't have an inhaler. That is it for this video. I hope you enjoyed. I hope you found it informative, and I'll see you in the next one. Bye, guys.